Hi, I'm Britt Carlson with Oroville Hospital. Today I'm joined by Dr. Sidharth Bagga. Thanks for being with us today.
Thank you.
First, tell us a little bit about yourself and your area of expertise.
So I'm a pulmonologist and I work in Oroville Hospital, and my goal is, my role here is to provide care for all patients with respiratory illness from either pneumonia, lung cancer, COPD, or asthma, and help them get through it and improve and get better.
And what's the specific procedure that you'd like to discuss today?
I want to discuss the concept of Endo Bronchial Ultra Sound, which is a novel concept over the last few years. Years prior, we've always had to diagnose diseases of the lung by doing something called a bronchoscopy. It's a camera that goes on the inside of the lungs and gets a sample of tissue. Unfortunately, we're not able to see beyond the inside walls of the lung. With an ultrasound probe at the bottom, you can see beyond the other side, on the other side of the wall, and you're able to get better diagnosis, more accurate, with less needle sticks. So patient has a higher yield with a lower risk than ever before. So there's a much improved outcome with that procedure.
Any hesitation for patients to try something just simply because it is a new procedure?
This has been proven to be very safe over the last 10 years. The lowest risk, the lowest complication rates of any bronchoscopic procedure out there. So it's very safe, and in fact, it only adds to safety, also adding to the diagnostic yield.
What kind of problems would patients be having and come to you maybe that they would need this procedure?
Typically, people who have a diagnosis of a lung nodule or a lung mass, which is identified now based on the national screening guidelines for lung cancer, if they have an abnormality in their lung, it needs to be proven whether it's malignant or not malignant. Those are the patients who come to get this procedure done, and this is how we're able to tell them sometimes within a couple of minutes what their diagnosis is.
All right. And how would a potential patient be able to get a hold of you in your office?
Typically, they just call my office, or you're referred at the number is 530-532-8654.
All right. Thank you so much for being with us, Doctor.
Thank you.